Hello friends, welcome to another fresh exciting episode of my podcast and my channel. Like I explained in 2 or 3 episodes back, these sessions are born out of my passive active interest in the NSPPD platform, the fact that so many people tune in and a host of them get to live without realizing that their diseases have been spoken about. And what that disconnect causes is that you keep on hoping for a miracle that has actually been talked about. And because you could not or have not achieved a diagnosis in your medical journey, or you haven't even sought medical help so far, you're unable to tap into the word that has been released just for you. So going forward, I've tried to do this looking at the episodes across each week, and now we're going to be doing it once a week, summarizing all the sessions, the streams of joy sessions for the week. So far this week, we had a prophecy on oropharyngeal cancer.
Oropharyngeal cancer. Oropharyngeal cancer. That's what I hear. The devil is a liar.
Now, this, as part of prophecy, has been reversed. But could there be someone who has been suffering from mouth and throat pain, who has gotten a non-healing sore on your lips or in your mouth, and the pain is causing you great difficulty with swallowing? Or perhaps you've got a white patch on your tongue or on the inside of your gums or on the tonsils further down, and this has lasted a few weeks. It's not healing, it's not going away. Your voice changed, your hoarse voice is another symptom. Or perhaps you've got an unexplained, unintentional weight loss. Now, in some cases, you could really be coughing up blood. Now, this is exactly the same symptoms as someone who's been to the hospital, done the test, has got a diagnosis put on his disease. So if you have got any of the symptoms, you would want to worry about finding out exactly what's happening with you. So you need to go see a doctor. I beg you, see a doctor, have some scans done, some camera tests put down your throat, look at what's growing beneath what the eyes can see, a biopsy done, a little sample taken of this sore tissues or the ulcers, and then maybe in some cases a CT scan. These are really bad illness, because obviously if you're not able to swallow, take things by mouth, you're going to gradually decline. Weight loss and loss of strength, all of those will come on board. Some of the common causes are the HPV virus, the human papilloma virus, which sometimes some of you who like to put your mouth in certain places could easily contact. But bottom line is early detection. Prognosis is good if you find it early, start to treat it. Chemotherapy, radiotherapy, surgical excision, like a cut of the bad parts. That's the bottom line. So if you've picked on this word and maybe skipped across it because you do not know that we're talking about it at this time, please, I beg you, match your symptoms with your faith. Do seek medical help. Believe God for a turnaround, and hopefully all things will work together for them who do their due diligence. Going further down the line, we also this month had cancer of the gluteus maximus.
Cancer of the gluteus maximus. The devil is a liar.
Nobody who is not in the medical field, who has not been to the hospital, got a diagnosis on, would really relate this to what might be going on. So have you got a lump, a pain on your bum, something that's perhaps resting on the nerves in the back, and when you see it, it starts to hurt? And are you having itching anus, some form of a swelling around your anus? Are you thinking that, well, you've got a few bleeds that are uncommon, it's not bile, but you know you're bleeding, or you're even leaking feces? Now, if you've got a swelling on your bum, look at it this way. It's not God trying to give you a BBL you haven't paid for or even solicited for.
No! God, please, no! No! No!
It is serious. If the swelling isn't going away, a couple of weeks, it's getting bigger, you're struggling with pain, why are you still sitting down? Well, you can't even sit down because it hurts when you sit down, but why are you still sitting on the symptoms? You need to pick up yourself, go and get looked at. You need an examination in the hospital. Someone needs to press around that area, be sure this is a mass, and tell you what next needs to be done. After the examination, you might get a scan, some jelly scan put on it to see exactly what is growing underneath the skin. It's usually deep. The gluteus maximus, like it was mentioned, the cancer of the gluteus maximus. Gluteus maximus is the muscle at the back of your bum, so it's that holds it quite firm in most cases, but it's the cancer grows underneath the deep fascia, the deep layer of that muscle. So a biopsy might need to be done. A scan, like I mentioned earlier, if it's caught early, an excision would probably be the plan. And then if you're in the habit of holding to the prophecies, when this word comes out, go play back. We're talking the 24th of June. It is your word. You've got a swelling on your bum. It's causing you distress. You're leaking poo. That's your word. Pick on it and take your miracle from that angle. Now, also, the next day, 25th, we had a mention of megaloblastic anemia.
Megaloblastic anemia. Megaloblastic anemia. If you are the one, put it on the lasham. The devil is a liar. I announce, let it be reversed.
This is a relatively common one. What happens in people who are unable to absorb vitamin B12 or folic acid and they get anemic. Anemia means red blood cells. Probably some of you know about it, but red blood cells are not as many as they ought to be, and because they are the ones that carry oxygen in the body, you find that you struggle with energy levels because the oxygen supply isn't as adequate as one who's without an anemia. So red blood cell deficiency caused by vitamin B12, lack of vitamin B12 or folic acid, that's the megaloblastic anemia. To be able to know that this is you, obviously you would have suffered from fatigue, tiredness, you can't seem to pick up energy, you're kind of lackluster in performance, and a diagnosis would require you to have some blood tests done, and also gastric cell biopsy in most cases if we're looking for intrinsic factor deficiency. Now these are big words, perhaps not ideal for you, but if you have an anemia, reduced red blood cell, tired, fatigue, all of them mean the same, and you've got these symptoms, get yourself looked at. Blood cell, simple full blood count will start to guide us, and the vitamin B12 testing. Replacement is usually the key to solving it, so most people would get tablets or injections given to try to replace this B12 or the folic acid. Again, a big one that came across this week was nephroptosis.
Nephroptosis. Nephroptosis. Nephroptosis. If you are the one, put it on the lasham. The devil is a liar. I announce, let it be reversed. Let it be reversed.
Really, it's not something I've come across oftentimes in my career, but I had to go do some digging, and yes, it means floating kidneys. Nephro is kidney, nephroptosis means it's a floating kidney. Why would someone's kidney suddenly start to float? That's the question. And how could you know if you were the one? Now, if you've got pain on the sides, the kidneys are somewhere right there. You've got two in most cases. So if you've got pain on the sides, just sudden onset and sharp pain, you might want to get yourself looked at. Some people could have developed this as a result of sudden severe weight loss, or in some cases they might have had an injury to the flank, someone has given a huge blow, and natural causes like pregnancy and some form of a traumatic childbirth can cause a thinning of the ligaments and stretching of the ligaments that hold the kidneys in place. Now, if you've got pain in there, nausea, chills like a temperature, and you also have a sudden onset high blood pressure, all you need to do is to get yourself seen, have your urine tested. A urine dip will show blood in your urine in most cases, and some severe large amounts of protein in the urine. This kind of lead you towards that certainty that this is you. What do you need to do? You believe God because obviously you're a Christian, you follow the streams of joy, and you want to hold on to your prophecies and the word that has been released on the 25th of June we're talking about. So you need to as well get your own diagnosis. A few things can be done. A scan looking at what the kidneys are doing, like a diet test, and then things that can be done on your own side while you're believing for your miracles, a weight gain. So progressively, if it's because you've lost weight drastically, you need to put on a bit more to get the capsule, the fatty capsule that hold the kidneys in place to regrow. Surgeries to try to reattach these loose kidneys, and sometimes medications are ultimately important because if you've developed high blood pressure because of what your kidneys have done, then you need that treating. So, as I say, This is not to discount the prophecies. This is not to discount that you're a believer. It is to help you as you participate in the programs, to help you to build your faith and to add some work to your faith. Next day, the 26th, we had a primary central nervous system lymphoma.
Primary central nervous system lymphoma. Primary central nervous system lymphoma. If you are the one, put it on the live stream. Mercy says no. Mercy says no. Let it be reversed.
Now, the central nervous system, most people who've done biology will know it's got the brain, the spinal cord. And then this lymphoma means, again, a cancer word. It means it's an aggressive tumor affecting the brain and the spinal cord. And how do you know this? Persons who have got depleted immunity, suppressed immunity, if you've had HIV, transplants, and severely ill, any form of previous cancer, that's a problem. That could also predispose you to this primary CNS lymphoma, central nervous system lymphoma. You need to see a doctor, my dear. You need to have a lumbar puncture. So your spinal cord has got some fluid inside. You need to take a little bit of it, take it to the lab and see if it does grow anything. Now, in this case, you would need some chemo and some radiotherapy, medicine, some rays given to try to deal with this spreading cancer. And like I said, if you've got pain, you need pain management. If you've got any form of swelling, they need to also start to work towards a surgical approach. And finally, this last week, first 3 days of the last week, we had the basal cell carcinoma.
A basal cell carcinoma. A basal cell carcinoma. If you are the one, put it on the live stream. The devil is a liar. By the mercies of God, I announce, let it be reversed.
This is the carcinoma. You all know, if you follow the program, you already know that we're talking of cancers. Basal cells, these are the skin cells. It's the most common form of cancer, usually found in light-skinned persons, but you could also find it in dark people. It's usually painless outgrowth on the skin. Sometimes it's got a shiny, small blood vessels on the surface. And because it grows so slowly, in many cases, you tend not to take it seriously. But it is serious and it needs to be looked at. Get yourself to be seen by a doctor who knows about skin. With a dermoscope, they will usually be able to characterize it. A dermoscope is like a little instrument to look on the surface of the skin. And then when this is done, biopsy of the area, just to again in the lab prove that this is a cancer. And then after that, we're talking surgery to excise the area and the little borders to make sure that this doesn't continue to spread. It's quite a rapidly spreading cancer if nothing is done. So do match your words with your faith. Again, that's my mantra, match your words with your faith. So have you gained anything from this session? Are you still in doubt as to what your diseases mean? I encourage you, even if we haven't said it so far, we might come to it at a later date, but delay is dangerous with all diseases. Get yourself seen by the doctor, get yourself looked at thoroughly, and do not assume that the gods will do for you what you need to do for yourself. You need to do your own work. God will meet you more than halfway. Exercise your faith, and it will be done to you according to your belief. My name is Dr. Giobiro. I am the GP. I've got a special interest in YouTube, and I'll be seeing you shortly. Please like, share, subscribe, leave a comment, tell us if we're doing it wrong and how we could do it better. I would appreciate that. See you shortly. Bye.